Hyperion X5 is the first suspended 3D/2D system and the world's smallest. Innovative, versatile, easy to install and use. 3D scanning is only possible if Hyperion X5 is connected to a PC with the Iris software installed. First of all, launch Iris by clicking on the desktop icon. Before the examination, the dentist selects the patient's personal profile from the database. Accessing the 3D section, he will find a screen showing the CBCT program. Via the special icon, the dentist selects the size of the field of view from the list. He defines the center of volumetric reconstruction by selecting on the screen the anatomical region of interest. Finally, he chooses between standard resolution and high resolution. To continue, press the button once, and then again to restore the default position. Once the default position has been reached, the dentist must place the support element before positioning the patient. For a successful X-ray scan, it is important to start by correctly positioning the patient. The first operation adjusts the height of the device. This is done from an onboard keypad. Once the correct height has been reached, the patient grabs the handles and rests her chin on the chin rest. By adjusting the height of the bite, the dentist asks the patient to make sure her incisors are in the groove so that the incisors' interproximal space is aligned with the bite's midline. To ensure maximum positioning accuracy, laser beam projections on the patient's face are needed. Looking at the mirror and watching the vertical sagittal trace, facial symmetrical positioning can be improved. To adjust the head tilt angle and obtain the correct positioning of the Frankfurt plane, the dentist uses the up and down keys and the wheel to adjust the height of the laser. Once the examination parameters have been set and the patient is positioned, the dentist can press Next on the virtual console and then switch to the PC for the procedure follow-up. From the Iris software, the dentist selects the patient scan protocol and the scanning mode, Eco or Regular. Using Iris, Scout images can be captured to allow the patient's anteroposterior position to be adjusted within the field of view. By holding down the Control key and moving the image with the mouse, the patient's position can be accurately adjusted. When the parameters are set and the patient is correctly positioned, the dentist presses Next, and before leaving the room, asks the patient to close her eyes and swallow. Once the scan is completed, a message is displayed on the computer screen to inform that the button should be released. The scan has been completed. MyRay, a comprehensive, innovative instrument range to optimize your workflow, improve communication with the patient, and make your every diagnosis perfect.